Hello, we're going to start by scanning my audience. Hello, my name is Jessica Slotcavage and I'm going to discuss with you hypoglycemia. Hypoglycemia, a form of diabetes, is having low blood sugar levels under 70 micrograms per deciliters. Knowing the symptoms and treatments associated with hypoglycemia is very important to everyone's health, even if you're not diabetic. I'm going to be explaining symptoms and treatments and helping you to understand and control sugar levels. Hypoglycemia is when your sugar level is below 70 micrograms per deciliters. Some of the symptoms that I listed are, the first four are symptoms that I have when I have hypoglycemia, and the last one is a severe symptom that I thought was worth mentioning. The symptoms are weakness, shaking, headaches, and irritable. And the last symptom is double or blurred vision, and this is very important. Some of the causes for hypoglycemia are if you're diabetic, taking your medication at the wrong time, or too much insulin, or too much diabetic medication. Also, not eating enough at a meal, or skipping meals can cause you to have hypoglycemic symptoms. Preventing and dealing with low blood sugar, some of the things that you can do is knowing the symptoms. Drink a small amount of fruit juice or regular soda if your sugar is low. And check your sugar levels. Knowing your sugar level is important. If your sugar level is low, you should eat something with sugar. If your sugar is normal, you should have a snack between meals. And if your sugar is very low and you are experiencing very severe symptoms, you should call a doctor and get medical help. How to check your sugar levels. I have a visual aid that I'm going to go over with you. You would start by cleaning and prepping the skin of one finger, usually the outside of an index finger. Some of the devices that you can use, there's a pen-like or a disc-like device. If you used a pen-like device, it would look similar to this, and you would you would stick your finger on the outer edge. You would place a drop of blood in the device, and then you would wait about 15 to 20 seconds for a reading. And I have a machine here, so I'm just going to show you. You would take an alcohol prep and wipe your finger on the outer edge. You would set your pen, and then you would press it against your skin. You would push the button, and when you get a drop of blood, you would put it on the test strip. And this is an example of one of the test strips. And you would put the blood on the strip, and then this would be your meter, and you would place the strip in the meter. You would wait about 15 to 20 seconds, and then you would get a reading. And your reading would be shown here on the meter, and it also has a memory for you to be able to store your other readings. I've reviewed some of the causes of hypoglycemic. Some of the causes are if you are diabetic and taking your medication at the wrong time, or if you're taking too much, if you're not eating enough food at a meal, or if you're skipping meals. I've also reviewed how to prevent hypoglycemia, and those would be knowing your symptoms, drinking a small amount of fruit juice or soda if your sugar is low, and checking your sugar levels. There's no cure for diabetes. I'm just going to go over my survey real quick that I had sent out to the class. I asked if your race was, what your race was. Mine's Caucasian, my age is 32, and my gender is female. I do have a family history of diabetes, I eat 2 to 3 meals a day, and I eat about a medium-sized portion. I usually eat 2 to 3 snacks, and I eat about every 2 to 3 hours. I drink about 64 ounces of water. I do not take a vitamin daily, and I exercise 5 to 6 times a day. Thank you.